You use too many antimicrobial agents in your soaps and take too many antibiotics, you actually sterilize and rid yourself of the beneficial bacteria that protect you and teach your own immune system to behave.
The Pet Health and Happiness podcast from Bella and Duke, helping you at the cutting edge of pet nutrition, behavior and health with expert interviews, mythbusters and more, to ensure your pet lives a long, happy and healthy life.
Hello everybody, my name's Rowan Sanderson. I'm the CNO, Chief Nutritional Officer here at Bella and Duke, and this week I have the luxury of interviewing the immense Dr. Emily Stein. Dr. Emily, welcome.
Welcome. Thank you.
Dr. Emily, please tell us a little bit about who you are.
Yeah. So I am what is called a microbiologist. So I study things that you cannot even see that drive so much of the nutrient cycles in our world around us. And wow. I'm focused right now on driving health outcomes due to these little microbes that outnumber all of us.
Now that's a really interesting fact. And I think it's often repeated that there are more bacteria on and around us than we have actual cells. Is that correct?
Absolutely. And even the powerhouse of all of our cells, called the mitochondria, was once an ancestral microbe.
Cool fact. And I often like to repeat from a functional medicine perspective that actually bacteria are friends to us in the most part, and they're our first line of defense against those pathogenic bad bacteria and viruses.
Absolutely. So I've spent, after my doctorate, I went to, as we call it in microbiology, the dark side, and I studied the human side of the equation. And there in rheumatology, what we've seen is if you cleanse yourself and you're too aseptic, so you use too many antimicrobial agents in your soaps and take too many antibiotics, you actually sterilize and rid yourself of the beneficial bacteria that protect you and teach your own immune system to behave and regulate itself. And so what we see are folks that have had a lot of antibiotics or use a lot of antiseptics or are too clean actually are more chronically inflamed than a person who has a nice, robust, diverse microbe, or what we call the microbiome, which is the entire microbial self that coats every single surface of us.
I like the fact that you actually did a microbiome emoji.
Yeah, right?
Well, yeah. I believe Dr. Stephen Gundry is now calling it the holobiome, as in everything which lives on our skin and hair and the rest. Whether or not that's accurate, I don't know. Now, this is really interesting and very topical given what's going on with various viruses around the world and everybody being told to sanitize their hands constantly.
Yes. In fact, I have been traveling quite a bit and I do use bar soap. And I don't shake hands and I try and minimize touching other things because you do transiently pick up microbes from your environment. They don't necessarily inhabit all the deep crevices in your skin, but you definitely do pick it up and you can easily transmit it to a place that's vulnerable, such as your mucosal surfaces in your mouth and in your lungs, which is where coronavirus, for instance, gets in.
Exactly. I'm a big fan of using essential oil sprays, which are apparently about 99.9% effective with none of the downsides. Somebody did suggest vodka, but I think that makes you a bit of a fire risk.
That's true. Flammable.
So, Dr. Emily, where is it that you work?
I work for a company called Primal Health, and I started it, the science that drives Primal Health, I started over 10 years ago now. Okay.
And what is your current product that we're going to be discussing today?
Yeah, so it is a product that I have plenty in front of me. It's called Teef. I don't know if you can see that.
Perfect.
Yeah. And so teeth is built as a result of my personal losses in my family that have almost succumbed to a very preventable disease, which is driven by the very bacteria that I spent, 8 years of my life fascinated by. And that is the microbes that inhabit the mouth. So this approach, this product drives the metabolism of bacteria below the gum line and in the tongue, all the mucosal surfaces, to grow the protective bacteria. And at the same time, don't allow the harmful disease-causing bacteria to grow through nutrient pressure.
Okay,
Yep.
So there's two factors we need to tease out here, I think, for those listening. And that is, one, there's clearly a backstory, which I think we're going to jump into in a moment. But two, can I re-summarize slightly? So the teeth, it's a pre and probiotic?
Pre.
It's a prebiotic. And what it does is it selectively targets bad bacteria, which lives in the mouth, and encourages positive bacteria to actually populate the mouth.
Correct. So you'll notice that when you're brushing your teeth with toothpaste, or you're looking at what is available on the market for your pets, they all have preservatives in them, which actually kills protective bacteria. So this approach is just a simple, I don't know if you can see this, a simple combination of 4 nutrients that is, one is a vitamin, so it can turn the water just a little bit yellow, but dissolves entirely in water, human grade, so I drink it too. And what it does is it dissolves in the water that you drink and coat your mouth surface with, or your dog. And because it's diluted in water, it can then, I don't know if you can see this, penetrate way below the gum line. So underneath the gum tissue, just to give you an orientation. So this is a healthy tooth. And then this is a tooth that's starting to have some gingivitis and periodontal disease and severe perio. So what happens over time is this soft tissue degrades. And that leaves us all vulnerable. In fact, 80% of humans, 80% of pets all have this same problem. But way below the gum line is where I need these nutrients to go. And below the gum line is really where those microbes, we're talking trillions of microbes, reside. So you can't get a vet to brush them away or to scrape them away during a dental cleaning. You can't, we've shown over the past 40 years in dentistry, you can't give antibiotics. The bacteria keep on coming back. So instead of beating down the bacteria, we're trying to change who can live down here. And by doing that, we're preserving the integrity of this magic tissue that holds teeth in place, and also stop then the bacteria from gaining access inside, which has threatened the life of both my grandmother and an older rescue dog.
Oh my goodness me. I mean, this is science meets magic. Okay, can you talk us through what the ingredients are?
Certainly. So in this single scoop is a soluble fiber that is made from plants. Bacteria actually convert the fiber into what's called cyclodextrin, and that's a cyclized fiber. It just passes right through our GI tract. So the dog and the human, we do not degrade this or digest it. But what we found, which is what we patented, is this fiber actually blocks the bacteria from eating carbohydrate, which is critical because we're finding that carbohydrate it's in all diets. It's in bone marrow, it's in muscle tissue, it's in a lot of the dry chow that they give to dogs. And it grows harmful bacteria that strongly drive the disease process that causes premature death in all of us. So that single ingredient is having a significant effect. That's only one. There's three more.
I love this because, frankly, there are so many people at the moment, and I'm really, rather than trying to combat them, I'm looking to educate and win them over, who are saying, dogs aren't wolves, they can digest carbohydrates. And to which I reply, yes, they can. They do produce amylase, albeit not in the mouth. They do produce it elsewhere. I mean, they are producing amylase. Cool, which is the enzyme which breaks down bacteria. However, being able to do something and actually it benefiting you are two totally separate things. As humans, we know that. We can go out and drink 3 bottles of red wine. That doesn't mean it's going to do as good. And same thing, dogs. We're seeing astronomical rises in pancreatitis, which I believe there's about to be some exciting research coming out very soon from Alaska, from some sled dogs, showing that it's actually been bacteria or carbohydrate all the time. Mm-hmm. No surprise.
Mm-hmm. Yeah, and in fact, so you'll notice that, so in the human biology side now that, they're finding this also on the animal side, if you follow in the body where most of the carbohydrates are consumed, the brain, the mouth, and the pancreas, there's this particular species called Porphyromonas. He lives below the gum line. He escapes and goes to the brain, and he also escapes the mouth and goes to the pancreas. He is the most strong indicator of risk factor for developing Alzheimer's and pancreatic cancer, not just periodontal disease.
Wow. And
yes,
what is the name of this bacteria?
The human species is called Porphyromonas gingivalis, but we've also tested dogs, and we've seen Porphyromonas gingivalis in dogs' mouths as well. The dogs also can have in their mouths Porphyromonas species that are unique to dogs, but we've also now seen that in humans. So there seems to be an exchange of microbes based on who you cohabitate with. So we tend to share a certain percent of our microbes with our dogs and vice versa. And these organisms however, they do not eat carbohydrate themselves. They eat the waste products of glycolysis. So they are eating all the surrounding bacteria that are digesting the sugar are secreting out waste products that these organisms must have to grow.
Wow. So this is, you said, the single biggest indicator in Alzheimer's and pancreatic cancer.
Correct.
And did I also read that there's a huge correlation between the prevalence of this bacteria in your mouth and heart disease, that Correct. It can spread to the valves of your heart?
Correct. And now there's some evidence suggesting, so this organism by itself has enough in its armament to secrete these factors that literally spread open and create holes in your gum tissue and spread open and create holes in your blood vessels. So they're burrowing into carotid arteries and correlated with atherosclerosis. They're burrowing in heart tissue and setting up a new home in there, which can cause biofilm-related heart valve or pericarditis infections. And then they're burrowing through the blood-brain barrier and cohabitating with our neurons, which burn a ton of sugar.
Oh my goodness me. I am so glad we've redone this interview. I'm actually learning loads. One thing I'm taking away from this, on one of the many things, is not only am I going to get Kismet straight back on the teeth, but I'm going to be drinking it too, and I'm actually going to get it for my family.
Yeah, I mean, we have Alzheimer's patients drinking. I mean, this is human grade product, even though it is packaged and branded and sold into pet stores and into vet clinics. And dogs can take it, cats can drink it, but it's all human grade. It's kids can drink it, older adults who need it. We really all need to be consuming this kind of strategy every day. We should restrict our carbohydrate intake. That's one thing to do. The second thing, which is to take this and the cyclodextrin to block that whole disease-causing food web. And then the other ingredients in here, which we have yet to talk about, are the 2 combo prebiotics that are actually literally steering the protective bacteria, telling them to instead start eating protein. And so when they eat protein, they secrete things that are anti-inflammatory, that keep the mucosal tissue in our mouths intact and happy.
Oh my goodness me. Oh, this is awesome. Dr. Emily, when we first met in Chicago, you very kindly shared the backstory to this product, which is super compelling. Are you disposed to share that with us now?
Absolutely. And I can even show you these lovely people.
Oh my goodness.
If I can, if my operating system is allowing it to. I might not be able to because
it's those upgrades in the PC.
I know. Yep. So, it might not work today, but I'm happy to talk about them, and I can provide you pictures. They're 2 amazing people. So my grandma Kamla, she's my best friend. She was so smart, never went to college, worked her whole life taking care of all of her kids. And she was very special. I still remember her laugh. And she would beat the pants off of me every day in online Scrabble. And to the point where my whole academic research lab at Stanford, we were all trying to gang up on grandma to beat her. And she would kick our butts every day in Scrabble.
Yes.
Yeah, but one day she didn't play. She didn't make a play. And then I got a phone call a couple of hours later from my mom saying that she had a stroke in the prefrontal cortex. And turned out a couple of days before that, she got her tooth extracted. She had periodontal disease. And I was in rheumatology at the time, and she had rheumatoid arthritis, which is why I went to the dark side and studied human diseases instead of bacteria. Interestingly, bacteria linked to rheumatoid arthritis. But she could no longer brush her own teeth. And in assisted living in the United States, they don't brush your teeth for you. So she suffered significant decay and problems, and the bacteria obviously went inside after that tooth extraction, and she stroked. And so I flew to her hospital room, and I took a sterile swab with me, and I swabbed her oral microbiome, and then eventually flew the swab and myself back to my apartment. And I spent a year biohacking her oral microbiome to find a way to stop it from causing any more harm. So that's how we first started. And then a couple of years after that, I rescued Tinsley, who was 10. She was a Cocker Spaniel, so Cockers can have some dental problems. They warned me she had some pretty intense breath, but she literally smelled like death. It was that bad. And that's my new puppy. Sorry, he's very vocal. And her disease had spread. Hey, Cash. No, bud. Her disease had spread so much that literally she had a bloodstream infection from it.
Oh my.
Yeah,
oh
so
my
she
goodness.
was hours away from dying. Hours. And pulled 21 teeth. And she was on many, many months of antibiotics to save her life and to clean up the rest of her body. And we did that. And then I started to biohack dogs' oral microbiomes, and because it's unmet need. And most people don't realize that every single tooth that gets extracted, doesn't matter if you're a cat, a dog, or a human, you can lose lifespan.
Wow. So, I mean, that is a super potent story. It really contextualized the magnitude of what you've achieved and how much we can influence our health just with this simple product. And I say simple in the same spirit that genius is simplicity. You've rendered it very accessible and really easy for everybody just to use it.
Mm-hmm. And when you look, thanks. When you look at a lot of these chronic infectious or chronic diseases, a lot of them have a microbial component. And in medicine, veterinary or human, the microbial component has always usually been ignored. And so folks like me, one of my biggest missions in life is to make the microbiome part of the conversation, part of the equation, to steer health for an individual.
Wow. This really appeals to my inner geek. I've noticed, and I'm a big fan of Dr. Alessandro Fasano's work about autoimmunity being a three-legged stool. Mm-hmm. And I think he and Chris Kresser basically itinerized about 10 types of bacteria which are autoimmune mimic and actually encourage the body to effectively attack itself. Mm-hmm. Things like Pseudomonas aeruginosa, some really hideous bacteria out there which seem to be linked with rheumatoid arthritis, mm-hmm. and all of these other autoimmune diseases, which is just, and interestingly, Kiran Krishnan's work, he's shown now that obviously intestinal permeability is also part of the equation, mm-hmm. and you can heal that with some spore probiotics.
Yeah, absolutely. And, also something that we need to discuss and needs to go really at the top of the line as far as medicine is to try and bring that mouth back into the body, and think about that too, because there is leaky gums, and that's a condition called gingivitis. And just like leaky gut, you get the same problems, except your brain is right here and your heart is right here. So it's actually a much more significant area of criticality to focus on.
Wow.
Yeah, because the blood vessels are right here. And the mouth is so well vascularized, right? And there's a superhighway of blood vessel goes to the brain, and there's another superhighway that goes down. And you want to really protect that as well.
Oh my goodness me. You have really opened my eyes to this. I know we've discussed this before. Wow, I'm really picked up. This is great stuff. I can't wait to get this out there. So the simple basic answer is to protect your mouth, protect your brain, protect your heart, protect your pancreas, look after your dog, look after your household with the simple product.
Yeah, it's pretty simple.
Awesome. Well, Dr. Emily, I would love, please, to invite you back. I am sure there are going to be a whole host of questions, and it may be fun to do a live and field some questions. So I appreciate you are ultra busy, but please let's chat again.
I'd love that.
Thank you.